Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about kissing disease. It is Epstein Barr virus. It is infection from herpes virus group. It can infect humans. Epstein Barr virus infection are very common. You may have already contracted the virus without even knowing it. It may associate with other disease. The expert now searching if it is related to cancer or autoimmune disease, or there is a relation between COVID-19 and this disease, Epstein Barr virus. So as regards this disease, Epstein Barr virus infection don't always cause symptoms. This is especially true for children. Teens and adults are more likely to experience symptoms, which can include fever, feeling tired or fatigued, headache, sore throat, swollen lymph nodes in your neck or underarms, swollen tonsils, enlarged spleen or swollen liver, body aches, skin rash. These symptoms can last from 2 to 4 weeks, though feeling of fatigue may last for weeks or months. If you have enlarged spleen, doctors may recommend restricting contact sports until you have fully recovered to prevent rupture. So how this virus spread? It spreads from person to person through body fluids, particularly saliva. This is why mononucleosis, one of the most well-known Epstein Barr virus infection, is casually known as kissing disease. But you can also get the virus by sharing personal items such as toothbrushes or eating utensils with someone who has an active Epstein Barr virus infections. Epstein Barr virus can also be spread through blood and semen. Epstein Barr virus can start spreading to others as soon as you contract it. This means you can pass it on before you even start to have symptoms of an active infection. You will be able to pass it on to the others as long as the virus is active, which could be weeks or even months. Once the virus becomes inactive, you can no longer spread it to others unless it reactivated. How to diagnose it? Potential Epstein Barr virus infection are often diagnosed without any testing. However, blood tests can detect the presence of antibodies associated with Epstein Barr virus. Some of these tests: viral capsid antigen, also early antigen, Epstein Barr virus nuclear antigen. So what about the treatment of Epstein Barr virus? No specific treatment or vaccine for it, and because they are caused by a virus, its infections do not respond to antibiotics. So instead of treatment, focus on managing common symptoms. This includes getting enough rest, drinking plenty of fluids, taking over-the-counter pain relievers to ease fever or sore throat, avoiding contact sports or lifting heavy things. So as regards the disease sometimes lead to complications like rupture of spleen, anemia, low platelet counts, it is called thrombocytopenia, hepatitis, myocarditis, conditions affecting the nervous system, including encephalitis, meningitis, and also Guillain-Barré syndrome. If you suspect may have active Epstein-Barr virus infection, it is best to see doctor if you are concerned about your symptoms. They can monitor you if for signs of complications and tell you what to look for as you recover. Symptoms of reactivation. Once you have contracted Epstein-Barr virus, the virus remains inactive within your body for the rest of your life. This is called latency. But in others, it can cause chronic or serial infections. Reactivated Epstein-Barr virus may cause symptoms similar to those of an initial Epstein-Barr virus infection in people who have a weakened immune system. Reactivation, some experts now search for the relation between COVID-19 and the reactivation of Epstein-Barr virus. As regard chronic Epstein-Barr virus, in a very rare cases, Epstein-Barr virus infection can lead to chronic condition called chronic active Epstein-Barr virus. It is characterized by ongoing symptoms and blood test results that show an active infection. It starts out as a typical infection. However, some people of immune system are not able to control the infection, allowing the active virus to linger instead of going dormant. These symptoms like swollen or tender lymph nodes, fever, enlarged liver, splenomegaly, fatigue, sore throat, headache, muscle pain, joint stiffness, anemia, liver failure. So some people develop chronic infection, but they believe genetic factors or mutation in Epstein-Barr virus infected cells may play a role in addition. So as regard this chronic infection may lead to severe complication like a weakened immune system, sometimes lymphoma, leukemia, and also organ failure. Sometimes Epstein-Barr virus can cause cancer, so it may lead to increased risk of developing cancer. So it may lead to nasopharyngeal cancer or cancer in the back of the nose. Certain types of lymphoma include Burkitt lymphoma, Hodgkin lymphoma, gastric adenocarcinoma, but all these cancer considered rare. There is some experts search for relation between Epstein-Barr virus and autoimmune disease like multiple sclerosis, rheumatoid arthritis, celiac disease, type 1 diabetes, inflammatory bowel disease, juvenile idiopathic arthritis, thyroid autoimmune disease like Hashimoto thyroiditis or Graves' disease. Thank you very much.